Welcome back. And this week we're going to talk a little more about trauma informed care. So, when you think of this, most healthcare providers are trained to ask one question, and that's what's wrong with you? What symptom brought you in? Where does it hurt? How long has this been going on? But trauma informed care asks a different type of question. It's more in the realm of what happened to you, and this shift might seem small of like what's wrong with you versus what happened to you, but it completely changes how we understand pain, chronic illness, and healing in general. Because trauma is not something that just lives in the mind. Trauma changes the nervous system, the immune system, hormones, digestion, sleep, and even how the body experiences pain moving forward after. And if practitioners don't understand trauma, they may unknowingly make patients feel worse instead of better. So, in this video, I'm talking a little more about what trauma actually is, how trauma lives in your body, why trauma informed care matters, and how healthcare can do better, and what trauma informed care is not. Most of the time, when you hear the word trauma, people often think of extreme, big, crazy events that have happened through war, violence, major accidents. But trauma is not defined just by like a single event in itself, which very well could be a cause for trauma. But trauma is what happens inside the nervous system when an experience happens that overwhelms our ability to cope or process what just happened. Um, yeah, that's two people can experience the same event where one may recover quickly and while the other develops long lasting symptoms. And the difference between what goes well in one person versus another, it's all to do with the nervous system. Trauma can come from many, many different experiences, including but not limited to childhood abuse, neglect, medical procedures, chronic illness, emotional abandonment, bullying, losing a loved one, feeling powerless or unsafe for long periods of time. And for some people, and I'd say most people, honestly, for most people, trauma isn't a singular event that just like created this chaos in somebody's body. It's years of stress without feeling safe within their body. And in that environment, the body kind of adapts to learn how to survive in an environment that is continuously like bringing these feelings and trauma up again. One of the biggest misconceptions about trauma is that it's purely psychological, but trauma is deeply, deeply biological in how it shifts and changes somebody. Trauma changes how the autonomic nervous system operates. The autonomic nervous system has two major big branches that do functions in the body. So, your sympathetic nervous system, which is the fight or flight, you're being attacked by a bear type of sensation, ready to go. Um, that's one. And number two is parasympathetic nervous system, which is your rest, digest, repair, where your body can feel safe and relaxed and has the capacity to repair your body when it's in that state. When someone experiences trauma, the nervous system may become stuck in survival mode, which is in the sympathetic nervous system overdrive. Some people remain in this like chronic fight or flight response, ready to like up and leave, and they're just like on the go always. They're unable to relax. The body is constantly on edge with these people. And these types of people can also experience anxiety, severe chronic muscle tensions, migraines, insomnia, even digestive issues, high stress hormones of cortisol levels. Um, that could be one area when someone's stuck in fight or flight. Other people can also shift into a freeze or complete shutdown of like chronic fatigue. They may feel exhausted, even numb, disconnected from their body, chronically fatigued, like I said, depressed, even. And in both cases, the body had to adapt. It had to pick one or the other to survive in what happened because it just was, it felt so overwhelmed with the experience that it had. But those adaptations can eventually lead to some sort of a chronic illness. Why? So then you were asking yourself why trauma shows up as physical symptoms if like all of this is going on. This is where trauma informed care becomes incredibly important while you're dealing with patients, while you're interacting with healthcare individuals, just anyone really. Um, Many patients with trauma histories develop symptoms like chronic pain, fibromyalgia, IBS, even migraines, autoimmune diseases, fatigue, or even unexplainable neurological symptoms that just don't go away. And yet, like when you might go to your Western medicine doctor, you'll often hear, like, well, the test results are normal, or it's mostly just stress. But from the patient's perspective, this can feel pretty invalidating of what they're experiencing. And because these symptoms are very much real in the person that's experiencing them. And the problem is that the problem is not that the symptoms are imaginary. The problem is that modern medicine often separates the mind and the body and how they are interconnected, but the nervous system does not make that distinction at all. And emotional experiences, stress, trauma, and physical health are deeply, deeply interconnected. And this is a concept that traditional Chinese medicine definitely has a better grasp at, that there's parts of us that aren't like separated. It's all connected, and one area is going to, when it's misfiring or stuck in overdrive, it has a hard time getting back to neutral and creating maladaptations in the body because it doesn't know how to self-regulate again. Next, going over the core principles of what trauma informed care is. Um, Trauma informed care is an approach to healthcare that recognizes this reality that majority of people have somewhat experienced. It's not like a specific therapy that you need to go through. It's it's a framework for how practitioners are to interact with patients. And you should really interact with like every single one of your patients, anyone that you meet that they have some level of trauma. Anyways, so these are the several key principles in this type of care. Number one, safety. Patients need to feel physically and emotionally safe. This includes respectful communication, predictable environments, and even transparency about the treatments. Safety is not just an emotional thing, it's how this person feels. Safety changes the nervous system, and when the body feels safe, healing becomes possible. Number two would be trust and transparency. Many Many trauma survivors have experienced situations where their body control was taken away. And healthcare can sometimes repeat that dynamic unintentionally. Trauma informed care focuses on being transparent of what your intentions are, what this treatment's going to do, the outcomes that it's supposed to predict and like have. You're kind of explaining everything that you're doing, why you're doing it, and what the patient can expect after you do such thing, treatment or procedure or whatever. Three would be choice and autonomy. This approach respects the patients have agency of their bodies. Practitioners ask for consent. They allow patients to stop treatment at any time that they want, or at the pace that they want. They invite patients to participate in the decision making. This restores like a sense of control within wherever they can give patients decisions in their best interest of safety and responsibility from the practitioner. This restores that sense of control that the traumatized patient feels like they've lost at some point in their life. Four would be collaboration. Healing works best when it's collaborative. So instead of a practitioner being somebody who just like dictates everything in the full treatment, the patient becomes like a partner in their healing process where you're kind of figuring it out together, working together in the goal that you want to get to. Five would be empowerment. The ultimate goal is not dependency. The goal is helping patients reconnect with their own resilience and capacity to heal. Okay, what does this look like in practice? So, what does it actually look like? Often it's the small details that kind of matter. For example, before I begin, I'll explain what I'm doing so nothing feels unexpected. If anything feels uncomfortable, you can tell me and we'll stop. You're asking for permission. Small reframes of what you're doing and how you're doing them can these small statements can make a huge difference just so that people know what to expect. It's signaling safety to their nervous system of like they know what is coming instead of just like freaking them out a little bit. How trauma informed care works with acupuncture. In acupuncture, trauma informed care is like one of you should approach every patient that you encounter with a level of caution that there is some history of trauma. Why? Because these treatments interact directly with the nervous system. And when someone feels safe during treatment, muscles relax, breathing deepens, stress hormones decrease, blood flow improves, and healing processes, your natural healing ability activates. Well, when someone feels unsafe, the nervous system remains in a defensive mode, which means that the body can't fully shift into repair. So sometimes the most therapeutic part of the treatment isn't the needle itself, but it's the sense of safety created in the therapeutic space with the person that you're treating. How I see trauma informed care in the future of medicine, I think how more and more people are starting to realize that at some degree and level, every person they encounter has some sort of trauma related to them and is beginning to recognize that it's something important. Many chronic diseases are not just mechanical problems, these are systems. Um, there are systems problems involving nervous system regulation, immune system, and the environment that you're in, your external environment surrounding you. So, this type of care helps practitioners kind of see the bigger picture instead of hyper focusing on one part. And it allows for us to move from a model of like, what symptoms do we suppress to make this person feel better, to a deeper question of what does this nervous system need in order to feel safe again. And when the body begins to feel safe, healing kind of happens naturally. As a disclaimer, I'm going to add this part in to this video also, and that is what trauma informed care is not. As this type of care becomes more and more popular, as more people are starting to recognize that this is an important part of care, it is also important to clarify what it is not, because sometimes the concepts can get misunderstood. Trauma informed care is not avoiding difficult conversations. Being trauma informed care does not mean avoiding uncomfortable truths. Patients still need Patients still need honest conversations about diagnosis, changes that need to be done and made, treatment plans, and difficult medical realities. So, the difference is how those conversations are held. Um, Practitioners communicate with honesty and compassion while maintaining the patient's sense of dignity and autonomy. You're not putting them down, you're not belittling them, you're still listening and acknowledging their feelings. But if harder conversations about what needs to change in order for the outcomes of like what you're trying to achieve need to be done, that still needs to be done in a very compassionate manner and not just skipped over because somebody is traumatized. A second part would be trauma informed care is not letting patients avoid treatment. Some people think that trauma informed care means giving patients complete control to the point where treatment never happens. That's not the goal. Practitioners are still to provide guidance, expertise, and recommendations. But instead of forcing compliance, it's like um, working together in collaboration of why and like what is to get to the outcomes that we want. And the patient understands the reasoning behind the treatment and participates in the decision making process. Trauma informed care is, as a practitioner in any arena of medicine who are not psychologists, this type of informed care is not psychotherapy. Healthcare providers do not need to become therapists in order to practice this type of care. You don't need to process someone's whole life story. You don't need to analyze their past. This type of care simply means recognizing that trauma may exist and adjusting your approach environment to support safety is number one. I think it's also in a very important conversation to have for practitioners anywhere in healthcare and the responsibility that you still hold as a practitioner when dealing with people who are traumatized. You're balancing safety of the other person with your own clinical judgment. Um, Understanding that safety does not mean handing over all clinical decision making to the patient to make them feel safe. It's creating a sense of, yes, creating a sense of safety is very essential to the healing that must be done in this person, but practitioners also have a responsibility to use their clinical judgment and professional ethics to uphold still within this dynamic. Sometimes a patient may want something that feels momentarily safe and emotionally feels safer in the moment, but long term could be more harmful or inappropriate from a clinical standpoint. For example, a patient might request a treatment that is not indicated for their condition. Or they may want a practitioner to avoid addressing a health issue that requires immediate attention. A trauma informed practitioner doesn't just simply say, whatever you want, I'll do exactly as you say. Instead, they acknowledge the patient's feelings, provide them that emotional support, but also while still maintaining a professional responsibility for this person's care. Um, this approach might sound a little like acknowledging the person's feeling. I understand this approach may feel uncomfortable right now. At the same time, my responsibility to make sure treatment we choose is safe and appropriate for your condition and effective. Let's talk about how we can respect both of those things. So it's creating this conversation around how to move forward if two pathways aren't aligning. And this type of care is not about abandoning your expertise at all. It's about combining your knowledge with empathy, with clear communication, and collaboration with your patients. The practitioner still holds responsibility for providing safe, ethical, and effective care while ensuring that the patient feels respected and supported. I feel like this was a very important topic and conversation to have this out in the world. When practitioners understand both what trauma informed care is and what it is not, something super powerful happens. Healthcare becomes less about controlling symptoms, and more about creating conditions where healing can happen and occur. Um, I lost my train of thought, but I think that's about all I want to say on this topic. If you found this helpful at all or have any questions about this topic, please drop down in the comments below, and I'll see you next week. Bye.